Hi, I'm Jason Leitch. I'm the National Clinical Director of the Scottish Government, and the Royal Environmental Health Institute of Scotland has asked me just to answer some questions. And I'm doing it by myself, not live, so I'm going to have to read them, and hopefully they'll give you some insight into the importance that environmental health has played in this pandemic in the first 7 months, and will have to play on an ongoing basis. I don't think it's exaggerating to say that we couldn't have got where we have got without the broad help of environmental health scientists, environmental health officers, and the kind of professional position and expertise that you hold in helping us to deal with what is an unprecedented situation. It's maybe helpful to understand what that unprecedented means. We crossed two thresholds last week. The world reached 22 million infections, and 750,000 people have died of this virus. This is not something to be trifled with. Scotland is doing well, but we are in no way complacent, and there is much, much more to do. So, to your questions. So the first question is, how has the way you work evolved over the past 6 months? So it's pretty much nothing like my old job. I still have policy responsibility for the quality and safety of the delivery system, for cancer care, for cardiac care, and for patient safety, which was my big interest before. But in the last 6 months, a lot of us, principally the three senior clinicians in the government, the Chief Medical Officer, the Chief Nurse, and the National Clinical Director, have had to adjust our jobs quite dramatically. More time in the media, more time with politicians, more time relying on my slightly old public health degree, and I never thought I would take social epidemiology back off the shelf behind me, but I've had to. And I think we've been in a good place. I've thoroughly enjoyed it. The days are long, the stakes are high, but I've tried as best I can to give the best advice I can, both to the population of Scotland and to the politicians who are the elected decision makers. Not me. I'm an advisor, not, fortunately, one of those elected decision makers. The second question is, what role do you believe has evolved for the public health community? I think the public health community has stepped up. I mean, it's always been ready for this eventuality. Public health never goes away. There's always been testing and tracing. There's always been health protection. But this is on a scale that I didn't think I would ever see in my lifetime. And the directors of public health and the connections into local authorities, environmental health and education and business and all of those things have had to really step up. And I think they've been transformed. I think in the main that's gone really well. The most recent outbreak in Grampian is probably the best example we have of that. Now over 400 positive cases linked to the nighttime economy in Aberdeen a few weeks ago. And 180 or so premises inspected since that outbreak started, advice given, people sorted out so they know exactly when they can reopen and what they can do when they reopen. And you can't do that without health protection, public health, environmental health, all working together to do that. That takes us to question 3, actually. Where do you see environmental health being placed in the ongoing response? I think somebody described it to me actually as the hammer and the dance. When we started on this road and we knew this horrible virus was with us, we shut society with a hammer. We didn't need many scientists. We just said, everybody stay at home. Now we're in phase 2, which this author described as the dance, because we are opening bits of society and then we're reacting to outbreaks. And you can see that in Spain, in France, in Austria, in Scotland. And then you do need help. You need, the treatment is about how you open that society safely. And a lot of that is premises. A lot of it is hospitality premises. Some of it is small retail, but a lot of it is pubs, restaurants, bars, casinos, bingo halls, all the places that environmental health know, frankly, a lot better than I do. So we literally can't do it without you and your expertise. And I hope you feel that certainly in local authorities and local public health teams, that has been well integrated, because we're going to have more outbreaks. There's going to be more factories like the food processing plant in Cooper Angus and more city challenges like there are in Aberdeen. Schools will, I think, probably be one of our next challenges over the next few months. Do you think there will be a lasting change in public attitudes towards public health and disease prevention? Well, I'm a bit loath to say that pandemics are a good thing, because they never are. Lots of people have died, lots of people are still sick, and people will be left with long-lasting health challenges. But if anything good can come of it, then perhaps it is more awareness of infection control, it's more awareness of community spirit, and it's a kindness in society to help one another. Even in my house here, everybody, all the neighbours put their phone numbers and put them through doors to make sure everybody could get all of the help they needed. And I think there will be a public health legacy, both in infrastructure, in the value we place on environmental health science and in public health science. And hopefully that will continue, and that will help us through whatever comes next. I hope not quite as bad a pandemic as this, but something will come. And then finally, question number 6, what changes to the ways we work do you see as lasting legacies of the pandemic? Well, that's a big and long question. I think some good will come of this. We in the health service, for example, have gone from 300 virtual consultations a week to something like 30,000. I mean, it's beyond all recognition. Lots of outpatient care, lots of GP practices now doing virtual consultations. I think that's a good thing. We'll have to keep up one-to-one, face-to-face care too, but we should balance it so people don't have to travel. And I think, as I said, I think there is a cultural and community hope that we will be able to hold on to some of that community spirit as we come out the other end of this. I think finally it's probably also given us an appreciation of the links across the system, both health and social care, public health and environmental health, all the bits of the puzzle that need to come together to resolve something as nasty as this horrible, horrible virus. So that's my 6 questions. Let me just finish with a big, big thank you, as I did at the beginning, for your help, for your wisdom, for your guidance. And I hope you feel integrated into that response, because it has been completely invaluable. And thank you for listening.